all. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So, with us today, once more, we have Dr. Stephen Phillips. He is a well published, Yale trained MD, a researcher, bestseller, and his focus for his practice and research has been that underlying the chronic diseases and autoimmune diseases can be infectious illnesses as well. So, Dr. Phillips, welcome.
Thank you. Thank you for having me. So I
Oh,
guess we're
great.
here to talk about dementia. Um,
Yeah. So before we go there, can I quickly show your book to the audience?
yes, of course. Thank you.
I am always so excited about it. So, Cool Beans, let me just very quickly once again introduce the book. So, this is Chronic, the Hidden Cause of Autoimmune Pandemic and How to Get Healthy Again. And if you see here, congratulations to Dr. Phillips and his team. The paperback version was released on this first. So, there is a Kindle version, an audio book, a hardcover, paperback, and even audio CD. So that is one. I have never ever, other than this book, I've never ever asked Cool Beans audience to go buy something. This is one book that I every time almost insist that if you do not have it, please have it. The reason is very simple. I think chronic diseases cause such a lifelong misery that the impact is really, really uh, unbelievable. And if this book is under your reading, if you have gone through this once, you can actually know how to try to get out of that situation, how to help with that situation, how to seek help for that situation, and where the hope is. So we are all very, very grateful to you, Dr. Phillips, for this. And
Thank
as I am being so salesy about it, I have no commercial interest in this. I just think this is an important book for the well-being. This is an essential book for a general well-being. Just like you have toothpaste for your dental hygiene, I think this book is necessary to understand how to identify that there may be a chronic disease and then how to seek help. So this is one. In addition to that, the topic today is dementia. Dementia is becoming even more of a concern because of COVID as well. So there are a few links that I have in the description that Dr. Phillips had sent them over. So I'm just quickly highlight them as that is my habit to show you the links before we have the discussions. So please, when you get a chance, look at them as well. And now, once again, Dr. Phillips, welcome and tell us a little bit about dementia. What is your observation and what is your research?
Yeah, thank you. So dementia is skyrocketing. The statistics are pretty grim, and the estimate is by 2050 it will triple compared to what it is now. And I think these aren't just kind of statistical stuff that we don't see happening around us. I'm personally witnessing it not just in my patients, but in my circle of my parents' friends and in older age groups of friends that I have, colleagues, doctors who are a bit older than me are coming down with dementia in really record numbers. I never remember seeing anything like this, even 20 years ago. And I was a practicing doctor then as well. So in my practice, we opened in 1996, and I've been treating a huge spectrum of chronic disease states, and neurodegenerative illness has always been among the hardest to treat. So there's a great deal of data linking many chronic infections to many chronic illnesses, and there is data linking chronic infections to neurodegenerative illness, but it's just, I think, a piece of the puzzle, and it's not necessarily the whole answer. So I wanted to approach it from a kind of multifactorial way, because I think this is a really complex problem and it requires kind of a complex solution and not a one size kind of fits all approach. So I was going to
Got it.
start with the simplest parts of things, if that's okay, and introduce a term that your viewers may have heard of or not heard of, but it's mammalian targeted rapamycin, which it's short is called mTOR, is what people refer to it as, and it's an enzyme system in cells that's essential for growth. And without it, we can't grow up from babies into adults, and cells can't grow properly. But it doesn't shut off with as we get older. It keeps growing, and it literally forces the cells to grow old. And it's really important in making what they call senescent cells. And when you look at the neurodegenerative illnesses, there's a reason that they happen later in life. Why don't teenagers get dementia as frequently as 70 and 80-year-olds? And it is linked to all these age-related situations. So we find that dementia, neurodegenerative illness is related to hypertension and type 2 diabetes and arthritis and cancer and obesity. And the central theme among all these things is mTOR. So in animal studies, if you feed them lots of sugar, just feeding them sugar and having their insulin go up, that's enough to signal mTOR to be stimulated. And that will drive these animals to develop Alzheimer's and develop diabetes, obviously. Go ahead, sir.
So I want to repeat this one. So you're saying, so tell me if I heard correctly. You're saying that when sugar is given, which then triggers insulin, because when the sugar is added to the body is going to produce insulin to move that sugar into our cells.
Right.
And that would produce a higher amount of mTOR, which in turn would cause senescence in the cells and start creating these damages that would result in dementia as well.
Right. So it's not just the senescence. It's also there's sufficient evidence that just sugar by itself can function almost like a carcinogen. You can literally cause cancer by just giving these rodents, lots and lots of sugar. So, and even obesity in the absence of type 2 diabetes is a separate risk for dementia. So you're like, okay, well, what is going on? It's not, they don't have to be diabetic. Why do obese people have a higher rate of dementia? And again, they have higher, usually higher insulin levels. And then there's going to be an infectious link as well. And with type 2 diabetes, it's a little bit more complicated because people sometimes think that the hypoglycemic, the low blood sugar episodes that happens with type 2 diabetes can also damage the hippocampus and things like this. But it's also truly just the effect of insulin on the brain. And they call it like a type 3 diabetes. Some people refer to, Alzheimer's. And that's why medium chain fatty acids can sometimes nourish the nerve cells in ways that, normal glucose can't. And there's some randomized controlled data that medium chain fatty acids can be helpful. And so
fatty acids may be helpful.
Medium chain fatty acids. Yeah, MCT.
And are these any food products?
Like coconut oil type stuff. Yeah. So, so obviously dietary interventions could play a role, but the problem is that the data is not really, really clear. There's some studies showing that plant-based diets and veganism has better outcomes than meat eaters in terms of dementia. And then there's other studies, going the opposite way. So it's not as clear cut about how best to eat. And some people really think that, keto diets are a better diet to have. But there's another topic we need to talk about, and that's homocysteine. So your viewers familiar with that?
Absolutely. Yeah.
So homocysteine is really super easy to lower. And it's just a couple of B vitamins.
For the viewers, newer viewers, my apologies for interruption. If you can give us an introduction to homocysteine as well, that would just keep completing our package here.
Homocysteine is a chemical that we all have, and some people, when it's much higher, it's associated with really bad outcomes. Early heart disease, early strokes, and it's even associated with some cancers, and it's associated with dementia. And for the longest time, we were taught that it was really very, very important. And then everything kind of flipped. Medicine goes in these fads, and it flips back and forth. And when I last took the boards, they were very much ignoring homocysteine and its importance. And now there's accumulating evidence that lowering homocysteine can improve subsets of cardiovascular disease, subsets of dementia-related things, and even cerebral atrophy. So it's such a simple way to do things. I have genetically high homocysteine. I take these combination of B vitamins every day, methylfolate and methylcobalamin, and my homocysteine is half of what it would be otherwise. And nobody can convince me not to do this. I think that it's a very effective, tool for me. And then what about high cholesterol? People with high cholesterol tend to, have higher rates of dementia as well. But they're really finding that it's a 27 hydroxycholesterol, which is kind of newer data. It's a subset of cholesterol. that raises the risk of homocysteine. Excuse me, the risk of dementia. And believe it or not, vitamin D supplementation can lower this 27-hydroxycholesterol, and there's some randomized controlled data that taking vitamin D can lower, parameters of cognitive decline. So none of
Really?
these are home runs though. But when I
Hmm.
like to see a little bit of our, randomized controlled data across multiple low-hanging fruit domains where it's easy to do, and these are cheap. I just want to start with the cheap, easy stuff. So people should know that there's a bunch. I mean, one of my favorite things that I advise for my patients is low dose lithium. Do you aware of that stuff? Or there's
No,
actually
please.
there's two meta-analysis on the topic because there's so many studies showing that lithium is neuroprotective, and
Hmm.
not the high dose lithium is given to bipolar people, but just tiny little bits of lithium, the stuff you get in a good, drinking water. And that's enough to, improve cognitive parameters. And I think there's probably like 8 or 10 randomized controlled trials, enough for 2 meta-analyses on the topic. So, how many do you need really when you're looking at something that's very, very low cost, very, very safe? I mean, I have never seen toxicity from low dose lithium. We're not talking about anything like high dose lithium where that people take for bipolar, which literally 300 times higher dose than the over the counter lithium, that the doses that we're talking about for preventing and reversing dementia. And also
So,
melatonin. Yep. Go ahead.
sorry.
Okay. No, please.
I had a question from one of the viewers. They were saying that are these discussions in your book Chronic as well?
A lot of them are. I mean, we didn't. The thing with chronic, yes. In a word, yes. Many of them are. I didn't go down some of the rabbit holes that I was going to go down with you today about the toxic exposures and the pesticide exposures, which are also a thing, because the infectious links, which we'll get to for dementia, are really well vetted. However, dementia is skyrocketing, and these chronic infections have been with us for millennia. They are just part of the human species. And yeah, you could say that vector-borne infections are going up because people are, encroaching on habitats that may be more wilderness and the deer have no place to go and this and that. But it's not going to be enough to cause a skyrocketing situation. So it's got to be the increasing toxicities or some other environmental, issue that we're encountering that's not allowing us to deal with these chronic infections as well. And you would counter that even some of these toxic exposures in the absence of infections are enough to cause neurodegenerative illness, because that's been proven in the
So
laboratory.
hopefully, then another book in the near future.
I know, I know. We talked about that. There's so much, there's so many things in medicine where people fall through the cracks, and doctors tend to be so siloed. And so, I mean, listen, I'm all for evidence-based medicine, but I find that they use it almost like a shield. They don't want to go anything outside of what's spoon-fed to them by a medical society. And if you're finding, I mean, a perfect example is what's going on with COVID. Really innovative and brave doctors have had much better outcomes than the standard of care, and yet they're, dismissed and worse for that effort. So,
In
um,
some cases, doctors are actually punished. There have been so
yes,
many. I mean, I can make this comment. I would spare you. Uh, there have been doctors who have been punished. There have been doctors who have been silenced. There have been doctors who have been fired. There have been doctors who have been just made fun of, shamed, embarrassed, their careers destroyed, their reputations destroyed. There is such a mess out there.
it
And I
is.
want to take this message and then move forward to say this. Does stress, number one, and number two, and I know that you have a list that you want to go over.
Mhm.
Just, I want to put my questions to you.
Yeah,
And whenever you feel like stress, number one, and number two, COVID,
yeah,
what is their
definitely.
role in this whole
So for
world?
neurogen, I mean, there is data that grieving will accelerate dementia. So, I mean, there's in medicine, the well-known thing about it's a Japanese name to a syndrome. We colloquially call it broken heart syndrome, where a spouse tends to, they die quicker when their spouse dies. And I did have a patient go into broken heart syndrome, which is a young woman. She went into heart failure when her mom died, and stress is a killer. And if people are under chronic stress, like the world has been for these past 2 years, what's it going to do to our health outcomes? I mean, there is a, how can I say this? Like, generational or beyond generational increase in all-cause mortality that's going on, a 40% rise in all-cause mortality compared to pre-pandemic levels. They're not really breaking down what the cause of this massive increase in mortality across multiple domains is. And that needs to be broken down. That data should be analyzed really, really well. It's not, but it's historic. And, if they consider a 10% rise in all-cause mortality to be a 1 in 200 year event, and we're having a 40% rise in all-cause mortality. And I don't think it's linear. I don't think it's a 1 in 800 year event. I think it's more than that. So stress is horrible. In terms of COVID causing dementia, certainly there's lab data that can happen, that it can cause changes in the brain that are similar to other neurodegenerative illnesses, which is super scary. We had the data with the, I believe it was the macaques early on, the monkey data showing that it caused Lewy body, Lewy bodies in the brains of these monkeys. And many viruses do that. In the, lower down on this, my list here, when I get to the viral part, we can jump around. So these proteins, like the Lewy bodies, it's associated with alpha-synuclein. Alpha-synuclein is a protein, which is considered an aberrant protein. It's associated with Parkinson's and Parkinson's plus syndromes. So things like Lewy body dementia, Parkinson's, and a couple of others. And it's actually an antiviral kind of a protein. So they've done mouse studies where if you give a mouse that is genetically unable to make alpha-synuclein a viral infection in the brain, the mouse dies. And nice, that can make alpha-synuclein, it contains the virus, and the mouse survives. And so why are we programmed to do this? Because it helps the mice live long enough to have babies, and it's an evolutionary thing. And it's the same with amyloid. So I forget if I mentioned this on a prior visit with you, but Harvard did studies in 2016 where they showed that they put salmonella in the brains of mice, and the mice made amyloid in response to the salmonella to effectively contain the salmonella, and they proved that amyloid is an antibacterial protein, and or peptide, they call it. And there's data showing that TDP-43 has antimicrobial peptides as well, type activity as well, and that's the protein that's associated with ALS and frontotemporal lobe dementia. So does that mean that all the all the aberrant proteins have antimicrobial activity? I have a very big suspicion that somebody's missing something when it comes to prion disease, and there's antimicrobial activity for prions as well. Because there is this theory now that prions is just an infectious protein particle, but there's a lot of stuff that doesn't really add up with that one. But that's a whole nother topic. It's really complicated.
Got it. Thank you very much. We can go back to your list as well. My apologies for interjecting these.
No, I like interjections. I was just going over the simple stuff first, like melatonin. I was actually started taking melatonin in med school, and because as soon as I started getting med school, we got access to Medline at the time it was called, and now it's called PubMed, and you couldn't get it before. I was like, thought I was the coolest person because we had access to these medical databases, and I read some study that in animals, melatonin slowed down aging of the brain. And I started taking melatonin when I was in my mid-20s. I didn't have any sleep problems, and I just made an impulsive decision. I've been on it for 30-something years. And I've had many MRIs with my illness. When I got sick, I started getting really complex migraines and neurologic symptoms and everything else. I must have 5 or 6 migraines. 5 or 6 MRIs of my brain. And the radiologist makes a big deal of my brain every time. It's like, your brain is crazy. It looks like you're like 20 years old. I'm like, I can't take any credit. I've been taking melatonin since I'm 25. And I really think it's been protective. And my brother, who's had an MRI at the same age that I have, he has some little spots and little age-related changes, and he hasn't been on melatonin for this period.
So you actually firmly believe that melatonin has an important role?
Well, there's also randomized control data. I'm just, looking at myself being the guinea pig because I happen to do that to myself. But yeah, there's randomized control data with humans, and there's already been good mouse data showing that even short-term melatonin reverses, visual spatial memory deficits, maze testing and stuff. So, again, I look at everything at risk-benefit ratio, because I went to Wharton before I went to med school. It's all about risk-benefit, and they say that that's the way it is in med school, but it's so much not. It's really not. Med school is more memorization and just like guidelines, and then the business stuff was seriously making a decision on the fly. And I still make the decisions on the fly. I say, is it riskier to withhold this, or is it riskier to treat? And most, all of these things I'm mentioning now, I use in my patients. I talk to my patients about it because I consider them extremely low risk. There's something called nicotinamide riboside, which is NAD, and there's another, there are other NADs too, like, different versions of this. But they were discovered by the team at Harvard, David Sinclair's team, and they extend life and health spans in rodents and reduce dementia. And there's some human data as well. There's an open label trial showing that it didn't help in humans, but then there's a randomized control trial showing that it did. So there's not a ton of data, but again, there's really good animal data, and there's at least one randomized control trial showing benefits. And then curcumin. When you look at the folks in rural India, how they're not getting dementia really, and they really think it's the diet, and they think it's the bioavailability from the turmeric that's simmered in ghee all day, and it makes kind of a lipid emulsion, because otherwise it's not, bioavailable. And so we do in my office, we carry a bioavailable curcumin that we give to patients as well, because I think that it's helpful. And it was in a
We
randomized
use
control trial. Yeah.
Yeah, we use curcumin, of course, as you mentioned. I'm from Pakistan, but still, we use curcumin almost in um, every food that we make, and
Yeah.
even downstairs in our kitchen, we have curcumin in that powder form that we put in the foods, and then we also have curcumin in the capsule form as well. And I want to take a quick chance here. Um, Erica is saying, I'm happy that it took her 12 years of her awful dementia and not throw her in her home. Erica, I
Well,
am, number one, I'm so grateful for you being a great child. And secondly, my sincere sorry for your loss. Sorry that your mom has passed away. I hope that she rests in peace. And thank you very much for being a good child to her. And thank you very much for being with her. And sympathies to you from myself, from Dr. Phillips here, and from all
yeah.
the cool beans. We are with you. Please tell us if we can do anything. So, back to you, Dr. Phillips.
Yeah. No, there's so many tragedies that we all go through. It's amazing that humans go on as a species. But so if we look at the infectious causes of dementia, I mean, I think chief among them are spirochetes and herpes simplex, and that's what researchers really are finding in major institutions that study these things. So the first time there was a spirochetal association with Alzheimer's, and they found it in Alzheimer's plaque, was actually in 1987. And it was ignored. It was published by Alan McDonald and ignored for, whatever, 30 years. And then, like I said, then they started publishing this data out of Harvard with salmonella. And other researchers before that were publishing that spirochetes were particularly amyloidogenic, meaning that they can produce amyloid in response to their presence. And, Lyme has always been a hot button topic for people. It's a very common infection, and it's highly, highly controversial, and everybody fights about it. Meanwhile, there are other infections that are also awful that no one even knows about and no one fights about. They just ignore them. So, but Lyme does seem to be a significant risk. And when I say that, when I use the term Lyme, I'm being super loose about it, because there are many, many spirochetes that don't meet the genetics to really be Lyme. They're not Lyme. They're Lyme-like, and there are other Borrelia species. And herpes simplex, the data is really, really strong, and they've known for years about the association, but they've actually done this kind of like little brain in a test tube model where they take a bunch of nerve cells, they put herpes simplex in there, and they show how the herpes simplex causes the Alzheimer's-like changes in the brain. And it's a super accurate cause and effect model. And then if you look at treatment studies, there's one of the studies which I was particularly impressed by was they looked at patients who had herpes simplex outbreaks at least 3 times in a year. They looked at how much anti-herpes medicines they were given, and they broke them down by treatment duration. The ones that got up to 1 month of treatment, and it varied a little bit by whether it was Valtrex or Acyclovir or whatever, but it was pretty across the board, uniform. The ones that got up to about 1 month had roughly a 50% reduction in dementia when they followed them years later. And the ones that got up to 6 months of antiviral treatment had about a 90% reduction in dementia. which is crazy to me.
Really?
Yeah.
So let me once again, I'm so sorry I'm repeating some parts of it because they even strike me. I'm a doctor as well. I should know these things. But what you're saying is that those who had herpes simplex,
Right.
they have a higher chance of dementia because the virus causes the damage to neurons. And if they have, excuse me, if they have been treated, the longer they've been treated, the lower their chances of having dementia.
Right.
So you did you say that 6 months worth of treatment
Yeah.
reduced dementia by
Yeah. The
90%?
ones that got approximately 6 months of treatment in that year, I guess, it did, all the study said was a minimum of 3 herpes outbreaks per year. So you know that each of these patients had roughly the bare minimum of severity of herpes. Because I think it's reasonable to just kind of on an intuitive basis think that herpes folks that never get an outbreak are probably going to be at lower risk than herpes folks who get multiple outbreaks. I'm not sure if that's the case. I don't know how well it's been studied, but I think that's reasonable. So at least they had some minimum level of illness where they all had that minimum level, and they compared them roughly as a group that way. But yeah, the ones who got more treatment did much, much better. And, again, it's about risk benefit. I think that these are relatively inexpensive treatments, herpes virus treatments. They've been around for a long time. They're generic, and I just don't see a large studies of them because they're in the category of repurposed drugs.
Got it. There's a question. John says, how about leptospirosis?
Yeah, leptospirosis is a nasty spirochete. It's not so common around in the Northeast. We don't see very much. I've seen a couple of cases though. And in terms of its relationship to dementia, it's not been all that well clarified.
Got
Syphilis
it.
obviously has been. I mean, syphilis produces, Alzheimer's-like changes. So we should know right away that, it should be like we should have gone into this whole Alzheimer's research thinking, wait, let me look for spirochetes. Just knowing from what syphilis brains have looked like for so many years, they should have been going down that road from the beginning.
Got it. Can I please ask you one more question? Dennis says, can untreated psychosis lead to dementia?
I mean, it's not so much that A causes B and B causes C. The question is how much inflammation of the brain is there. If there's an infection that causes psychosis, for example, when I have seen psychosis in my patients, Bartonella is a more common cause than Lyme is actually, and um, it all depends on how much microglial activation there is. So the brain has a weird immune system. It's not like the rest of the immune system of the body. It's these nerves, these like specialized nerve cells. And it's 80% of the immune system are microglial cells. So it doesn't work that great. And it's like a double-edged sword, just like the rest of the immune system is. You know how in autoimmune disease, the immune system is, like in my case, I had a diagnosis of rheumatoid arthritis and ankylosing spondylitis, and I was bedbound for 2 years. For the viewers who don't know my story, and I almost died. It's a whole long, miserable story, but 2 years of hell, basically. Lost 50 pounds, had 24-hour home care. So they diagnosed me with autoimmune conditions, and my immune system was really working overtime, but it wasn't doing the job. And this is what the whole field of rheumatology is about. They just try to suppress the immune system, whereas I was saying, wait a second, let me suppress the pathogen and augment and make my immune system stronger. And that's kind of how I got better. And it's similar for inflammation and infections of the brain. In terms of psychosis leading to dementia, that specific question, I'm sorry, I don't have a specific answer, but I have not seen it. I haven't seen young people with psychosis in the practice in the 20-something years that I've had a higher rate of dementia. But I've had demented patients that have psychosis as part of their dementia. Like Lewy body patients are almost always become psychotic at some point. They have visual hallucinations. They have delusions. Yeah.
Is there any relationship of EBV to dementia? And I'll tell
I
you the
assume
context of my
I,
question.
I assume that there must be. I didn't do a deep dive on that before coming here, but it's so ubiquitous, and I can't imagine that it doesn't have a relationship. I can't imagine that many of the herpes viruses don't. They seem to be focusing on the simplex viruses, But also, in addition to simplex, I know that there's a good deal of research about zoster and dementia.
Hmm. Hmm. And the reason I asked was that it seems like COVID and long COVID may actually have some EBV reactivation as well, which
Hmm.
the long COVID, there was a question as well. There are some patients of long COVID with the neurological issues. There are patients of COVID with the neurological issues as well. Now, how does that transpire in the future in dementia or not? We'll see. And then, is it the reactivation of EBV in addition to other damage that also contributes to that or not? We'll see that too. But there are factors there. I am really concerned about COVID and long COVID and dementia in the coming generation, in the
Right.
coming years.
I do. Yeah. No. Exactly. No. I thought everyone has been thinking this as well. What's going to happen? You know, if it does it in the monkey studies, and we're seeing it now in some human autopsies, and they're saying these are isolated cases and not to worry. Well, they're not doing autopsies on everybody. They're not looking at everybody's brains, so we don't know how often this actually occurs. And like I've told you before, we're seeing some long COVID in the practice that is reactivate other infections. So not just things like EBV, but other bacterial infections. We had some patients diagnosed with long COVID who we found out they had previously asymptomatic or minimally symptomatic other infections like Lyme and Bartonella and such, and treated them, and they've been well. So I do think that anything that stirs the immunologic apple cart can bring up a whole mess of stuff. And we think of the body as sterile, but I don't. I think of that we don't just have a biome in our GI tract, that we actually have a biome throughout us, that there aren't parts of the body that are sterile.
Hmm. Got it. Thank you very much.
So yeah, so the next on my list here is just the environmental toxins. And I think we talked about BMAA before, but just to recap for your listeners, there's in Guam, they have this very, very high rate of, or they did have this very, very high rate of neurodegenerative illness. It was 100 times higher than the rest of the world. And they
Hmm.
sent somebody to study it. And they linked it to eating these fruit bats, because the fruit bats ate the seeds of this fruit. And the fruit had concentrated neurotoxins called BMAA, because they had these cyanobacteria growing in the roots. And then they've looked and done studies of blooms of cyanobacteria in bodies of water and looked for neurodegenerative illness nearby, and showed clustering associated with these cyanobacteria blooms. They're also called blue-green algae, and they're not really algae. It's just a kind of a misnomer. And the L-serine can somehow displace BMAA, and they did some studies with ALS where they gave them varying doses of L-serine, and there was a dose response curve in slowing down ALS, and at the highest doses it worked better. And that highest dose equaled something like 15 grams twice a day, which equals basically doubling the normal amount of L-serine, which is amino acid that people would have in their normal diet. And if you look at areas of the world where there's a very high rate of L-serine, like in islands off the coast of Japan, it's similar to these hotspots of no dementia, like in rural India. They really don't have dementia there too. You could say other things also. Their diet doesn't produce a lot of insulin in their bodies. There's a lot of reasons why they probably don't have a lot of dementia there, but and that's one of them. And also, some components of seaweed are powerful anti-dementia agents as well, and that's been published.
Very interesting. So we started with the sugars and the insulin and that. Then we talked about a few of the other components. We talked about the environment, the stresses, even nowadays COVID, and then these environmental factors. For example, uh, BMAA. You have a
And paraquat and diquat. So pesticides. There's definite correlations with farmers getting Parkinson's. There's a big class action suit against some of these companies that make pesticides. And my dad used a chemical that was well known to cause Parkinson's and Parkinson's-like conditions, and he had Lewy body. And
Hmm.
it's the presumption is that these things can happen in the absence of infections, and certainly in animal studies, BMAA can produce neurodegenerative changes without infection. Just that alone is enough. It is sufficient. And you could say that just like in the studies with the mice where sugar is sufficient, there are many things that are sufficient. And if you have a little bit of them in conjunction, I just think that these things are most likely multifactorial because we live a multifactorial life. Like we're not getting these experiments done on us in a lab where you're controlling one variable. So to assume that there'll be one cause is probably not so intuitive for me. And that's why I think
Got
that
it.
the antibiotic trials are just not enough. We need other therapies. And, yeah, so.
Got it. So, one conclusion, this is the pesticide study that you had shared. Our work suggests that the risk of PD, Parkinson's disease, is increased in farmers exposed to pesticide on several French crops and livestock, and supports additional evidence of an association of Parkinson's disease with dithiocarbamate fungicides, rotinone, and the herbicides diquat and paraquat. So I just continue to sum up the discussion so that where if somebody is taking notes and they want to apply it to their life as well. So we talked about coconut oil being good. We talked about curcumin being good. We talked about microbiome. We talked about fatty acids. And then we're talking about here a possibility of the pesticides being harmful as well
Right. And
towards
lithium,
dementia.
melatonin, and NAD. And
Yeah,
also,
absolutely.
I've been looking into kind of out of the box stuff because I've been talking to some folks that do hyperbaric medicine lately. I don't know if you heard of Dr. Shire Fradi. He does these protocols with Alzheimer's, and he's talking about some success where instead of doing just hyperbaric for 60 minutes, they do hyperbaric with super oxygenation and then going down to room air and then up and then back to room air. And that going down to room air kind of tricks the brain into thinking there's hypoxia. And it's kind of a trick. And it's a signal for nerve growth when the brain thinks there's not enough oxygen. So, and he's, reported improvements in cognition and reductions in amyloid and both in animals and then the neurocognitive testing that was done in humans. So I thought that was kind of interesting. Then I called up some places and just to figure what their real world experience is, because it's one thing you have to be a detective with these things sometimes. It's one thing to read the study. It's another thing to call the centers that are actually using these protocols and say, how good do they work? Because these things are so expensive. And before I recommend a patient, I have to see if it's going to be worth it. And haven't haven't had the greatest feedback. I haven't had the greatest, so I don't think any of these are real home runs. But I have to tell you that, like in my dad's case, and a lot of people, my father went for cataract surgery, and he went for one eye. It was fine, and then the second eye, he came back, and one side of his face was black and blue, and we think they dropped him, and he didn't recognize his wife after that. And that was the beginning of this rapid decline in dementia. And it turns out that hyperbaric is really good at post-concussive illness and traumatic brain injury. And they've always talked that that's going to be like the next thing the FDA approves it for, but it's still not approved for that. So it won't be covered in the elderly that so desperately need it for that condition, because it could really prevent people from going down the road of dementia after a head injury when people are elderly. And it's a
So
real shame.
I want to give you some more data on this one. One of my friends runs a hyperbaric oxygen chamber organization, not in the US, outside in the Middle East. And they say, especially in children, so I think children have better growth possibilities, anyways, and
Mhm.
repair possibilities more than the adults. They say that, for example, brain injury or other reasons for a child's brain to not be as fast growing as possible, when they use hyperbaric chambers, they see marvelous results with the children turning around, repairing their brain tissue injuries faster and as better as they could, and then recovering. So
Right.
they are full believers of
Yeah, no,
hyperbaric
I spoke
chamber.
to someone today actually who recounted a story, one of her recent patients who was, I mean, how she described him is almost in a vegetative state, and he's graduating college now. So she saw him as a
Got it.
teenager. Yeah. But so in the elderly though, that if they don't have the same plasticity that the young people do, Is there something that could be combined? Again, like a multifactorial thing. And I was, the stem cells is kind of like a bit like the Wild West. And I know the FDA has cracked down on therapies that are anything outside of joint, related. But some companies are having, they're working with FDA to have other indications, because there's already animal data showing that intranasal, application of both stem cells and exosomes, which are the membrane-bound components that stem cells kind of elaborate to communicate with other cells. Just for your viewers, exosomes are like little mini circular things with a membrane around them, and they have tons of mRNA and microRNA and all these chemicals and proteins that tell other cells what to do. And a healthy cell can tell another cell to be healthy, and actually a sick cell can tell another cell to be sick, which is really kind of spooky. I think there's some data where they took exosomes from patients with depression and put them into animals, and animals exhibited depression, which is so bizarre. But you have to wonder, is this something that we should explore? I think for sure, they need more studies on this. Have you seen or heard, anecdotal or study info on reversal of dementia with stem cell or exosome type treatments? Because I have a little bit that I can share.
So I haven't yet, and that just may be my exposure or lack of my exposure.
Well, just coincidentally, like total coincidence, a doctor I know for a long time, his wife came down with dementia, and he sent me an email saying they did these couple of stem cell therapies, and she's basically back to normal. And it was an adipose-derived stem cell, and it's a company that's working with the FDA, and they did intranasal stem cell delivery, and it worked like a charm. And she's an elderly woman, and
That's amazing.
yeah, and he just recently told me that he recommended a friend of his do the same thing, and his friend's wife. So, but again, anecdotes, but they should be writing these things up and getting some good studies, going on.
So
And
is this, sorry, I'm going to dig in a little more on this one.
sure,
Is this stem cell therapy, intranasal delivery in the US available,
yeah,
or
only
was
in
it
certain
only somewhere
locations.
outside?
Only in certain locations inside the U.S. because, like I said, the FDA is very, very tight with these. They just fined someplace in New York City like $5 million not too long ago because the thing is the data they don't have the human data to catch up with the claims, and then the stem cell companies make a lot of claims, and it's not a panacea, and it doesn't always work. And I had a patient I remember about 8 years ago. He went for stem cells by a company that was closed down by the FDA. And I'm telling you, this guy's had a dramatic response that he's lasted 8 years. And I see him like once a year. He comes in to say hello, basically. And he's just markedly, markedly better. It's not like he didn't respond to antimicrobials. He always did. I get him like 95% better. And then we take him off. And within 2 weeks, he'd crash. And it was a seesaw. And it went that way for years. And he did these stem cells. And he's maintained a nice, healthy lifestyle ever since. So I do think there's value here. I'm uncomfortable making any broad claims though, because I'm so frustrated. I want everything to be done yesterday. And
Mm.
but I just
Mm.
think that your viewers should know that. And I'm actually looking for information too. It's not just about teaching. I'm on a quest for knowledge and learning. I mean, if any viewers know of stem cell companies that are doing innovative research and are working with FDA and have like legitimate operations where it doesn't look sketchy, I'd be very happy to communicate with them and see if maybe we can set up a study. It has great potential, I think.
Got it. I want to share, while we're discussing this, I want to share one more of the studies that you had shared, and that was uh, this one. And in this study, there was a specific paragraph which I thought is important for all of us to know. That was, let me quickly find it, this one. So here they're saying, uh, audience, cool beans, please listen to this. And there is a message in here, and that is, if there is a chronic disease, please don't ignore it as much as you can. There are some diseases we can't really do much about them. But check this out. And Dr. Phillips, thank you very much for sharing it. For this study, multimorbidity was defined as the presence of at least two chronic conditions from a predefined list of 13 types, including heart disease, high blood pressure, diabetes, heart failure, depression, liver disease, stroke, arthritis, and cancer. So there is a study that looked at the association of chronic diseases to dementia. And here is what they found. The research published in the British Medical Journal found that the risk of dementia was greater when these sorts of conditions developed at a younger age, mid 50s, rather than later in life. For every 5 years younger a person was when multimorbidity occurred up to the age 70, the risk of dementia went up by 18%. And I would suspect that it's not just the disease, but it is the longevity of suffering or the damage or pathology of the disease. So, whatever you can do to keep it under control, that would be great. Is that a correct message, Dr. Phillips?
Yeah, I mean, I believe so. I think it's a very compelling study. I mean, they showed that basically, if you had two of these chronic conditions by age 55, your risk was up by 2.5 times, and if you had three chronic conditions, it was a 5 times higher risk. And is it because these people with chronic conditions have infections, which raises their risk? Is it because they're having things like hypertension and diabetes because their mTOR is being driven because their diet is really kind of not great? But like I said, the many paths to dementia, my take home message that I tell my patients, and that's why we don't even encourage dementia patients to see me, because just with antimicrobial treatments, it's only about a 50% response rate, 1.5. But then if you add in antimicrobials and look for underlying infections, and then you add in, this whole litany of nutritional stuff and look for, we didn't, talk about how to test for, these environmental intoxicants and things like this. I'm not an environmental doctor, but we refer out to other doctors as well and try to work in this multimodal fashion, because the patients do not get routinely better with just antibiotics. Whereas I could say these other chronic conditions, like send me a fibromyalgia patient, and 9.5 times out of 10, I'm going to get that patient better in like 4 months, like durably
Got it.
better. And it's
Got it.
just a very different world.
I want to once again remind the viewers who may be new here, Dr. Phillips with Dana Parrish, is the author of the book Chronic. This is the only book I try to give it to everyone. I try to ask everyone to keep it because I feel so sincerely bad for someone who is in a chronic disease state, especially those that may be manageable, for example, infectious diseases. Some of them are manageable, some of them are still not, and we'll find out about COVID. So, this book is a treasure to understand how chronic diseases can occur because of infections, and then how to seek help and how to early on try to figure those out and manage them or have them managed. So this is the book here, Chronic, The Hidden Cause of Autoimmune Pandemic and How to Get Healthy Again. More than us adults, I think this is a book that should be in the hand of children as well. By children, young adults, so that if they ever encounter a situation that they themselves think they are getting into a chronic disease, if they have read this book, they will be able to identify it quickly and seek help. I think that is a big help for our own children to do it. So, once again, thank you very much for this book. And sorry
Well,
for the sales plug. I actually believe that this book should be with everyone.
thank you so much. Yeah, no,
Cool.
very gracious and very generous with your uh, recommendations. Thank you.
Thank you very much. So, what else in this land that you have researched so far about dementia?
Well, in terms of what I've seen, I mean, it just like early on, I would have a couple of patients that were, let's say, in long-term care facilities where we treated them with just antibiotics, and they came out of long-term care facilities, and the doctors were basically having a stroke. They just couldn't believe what was happening. And I thought, when I saw my first case of somebody responding to antibiotics like that, I was like, aha, I have the magic cure for dementia. And then 10 patients, it wouldn't work. And then we get another patient. So I guess the take home, like I said, I'm just going to harp on the same take home message that we desperately need multimodal approaches. And I do think the FDA kind of holds people back sometimes. But on the other hand, it's not that hard for people to start working with the FDA and get these specific, indications for studies so they can do intranasal or intravenous stem cells. It's not as hard as they think. And they should be publishing. And I'm willing to help. I don't need anything from it. I'm so motivated. Look, my dad went through hell. My father, they gave him a 5-year survival, and I don't think I know as much about this topic. I don't claim to be an expert by any means, but I knew less then, and we still got him to live 13 years with it. He didn't die from Lewy body; he died of a heart attack. So, they thought he'd be dead from Lewy body in 5 years, and the stuff that we gave him, which was largely antimicrobials. He did take lithium and did these other things, but we never gave him stem cells, and we never gave him hyperbaric, and we never gave him. We didn't talk about transcranial magnetic stimulation. It's not a home run TMS for neurodegenerative, but for things like Parkinson's, which is a Parkinson's plus syndrome, it can help the motor issues, not so much the dementia issues, but the motor issues. So I think it's like peeling a carrot. If you get a 10% lightening of your burden and multiple 10%, it adds up to a lot, because I don't know that we're going to find in most cases a single cause for this. And I don't think that that's what's really going to be the thing. I mean, sometimes you get lucky and it's just, boom, a single a single infection. But I also think that prevention is so much easier than turning this around. Like case in point with the herpes studies, where it's a prevention study. I mean, it wasn't intended to be a prevention study, but it wasn't a treatment study. And they are doing some treatment studies now with Valtrex type drugs on dementia patients. That's being done now, like as we speak. But who knows what it'll show? I have a feeling that prevention is going to be good and treatment will be really, really difficult with it, just that.
Got it. Thank you. Thank you so much. If I know that you are on the East Coast, I know it is about 10. So if you can give me a chance for a couple of questions as well.
Yep.
So let's see from the Cool Beans. There is a question here from Kelly. Does Dr. Phillips have any experience with black seed, Nigella sativa, and chronic disease and or dementia?
Not for chronic disease or dementia. I actually have some in the cupboard, and my experience stems from you, because you mentioned it and said it's the cure for everything except for death. And I bought it on Amazon that night. So that's my experience. It's in my cupboard. I do, if I were to come down with COVID, I would make it part of my breakfast cereal. Yeah.
Got it. Thank you very much. There's a question. I saw this question repeated. I did not understand it very well. That may be my lack of knowledge. Please insight on the USA 300 airborne MSSA pandemic. I'm not sure what that is.
So
we may have to get back on that question. Yeah. There is a question from Frisco Coupon. Does Dr. Phillips work with functional medicine doctors to work upstream to know why things happen and understand the role of the gut microbiome?
We work with a lot of functional medicine doctors. We even have a naturopath in the office. I'm an allopathic doctor, but I'm certainly an open-minded one. And we cross-pollinate, so to speak, all the time. So we send patients back and forth. And like I said, it takes a village for folks to get better. I think the microbiome is super important. When we use antibiotics in our practice, not all antibiotics are created equal. And people tend to paint them with the same brush. When I was disabled, I had a long time to think about these things. I completely revamped how I treat my patients. And before I went through my illness, I used to see C. diff colitis, Clostridium difficile colitis, which is the bad bacteria from antibiotics. I used to see that like once a month. And now I really don't even see it. We have a couple of cases since 2013, since I came back to practice, and they were just very unusual situations that weren't really. One person had inflammatory bowel disease, another person was on a medicine that we don't use in the office, so not stuff that would come from a general use. And so we take the microbiome super seriously. We don't see a lot of dysbiosis from the stuff that we use, but I also want to make a point that people sometimes look at the microbiome as just friendly bacteria, and they're not just friendly bacteria. They're out for themselves. In the book, we call them pathobionts because they're pathologic under certain circumstances, and the immune system has to keep them at an arm's length where they're close enough that we can get the good stuff from the microbiome, but not close enough that they attack us. And I do think that because there's so many yoga commercials, people think that it's just going to be amazing and just take more and more probiotics. There is the rare case of probiotic-induced sepsis that's actually been published where people took probiotics and got septic from these friendly bacteria. So,
I love your description of keeping them at arm's length. Yeah, they can, in certain immune depressed states, they can actually attack us and become a real problem.
right.
Uh,
And I've had patients come in that have never touched an antibiotic. This isn't one or two or three. I mean, there are many, many patients who lead a very, very clean life and never touched antibiotics, always eat a good diet. They get chronically ill and they get their microbiome mapped out and it's a mess. And they come in frantic. Like, how did this happen? When the immune system is dysregulated, the microbiome becomes dysregulated just from that without antibiotics. So
yeah,
it's it's a weird thing, but it's a vicious cycle. It's not just a one-way street with antibiotics being bad and microbiome being good. It's a mixed picture.
got it. So one more question, maybe probably the last question we'll see. So Mary says, wonder if Dr. Phillips also looked into Dr. Dale Bredson's work. Dr.
I have.
Bredson also has. So
I have. We make a lot of his recommendations as broad recommendations. We work with a functional medicine doctor who's really trained in the Bredesen protocol. We send a lot of patients to him. And, I've definitely seen patients that it's helped, and I've had patients where it hasn't. I wish it was everybody, it helped, but, or in patients that we think that it helped. Our patients are getting so many things. It's, we're not going to be in the position of saying to someone who's desperate and trying to get better from this horrible diagnosis, hey, let's do a study on you and do placebo controlled. So we're really throwing the kitchen sink at them, whatever we think is safe, and including Bredesen. So it's very hard to tease out what's working and what's not. But in the old days, I wasn't. In the old days, when I was started in just in practice, I was known as like this very overly conservative doctor for my field, and like we didn't do anything herbal. I was strictly allopathic. I wasn't open-minded about functional medicine stuff, and I still did get patients better with just antimicrobials. But I just always just nagged at me that we're missing something with this dementia group, and we have to solve this. So that's why I'm here.
got it.
Yeah.
So, Dr. Z, thank you very much for the super chat. Plus, here is a question. Where do we obtain melatonin and other vitamins to ensure their purity, if you don't mind sharing?
Yeah. I mean, the it's a good question about purity of supplements and vitamins. When things aren't regulated by FDA, there's always these exposés about vitamins that they don't have what they say is in them and this and that. So I'm not sure which brand is best or not. We carry some in the office for folks just out of convenience, but my practice model is not about selling vitamins. So we don't tell people to necessarily buy from us, and we just say the brands that we will carry. We get them from one of these suppliers that supplies doctors' offices. So, for example, Pure Encapsulations is an expensive but very highly regarded, brand. I feel like the big problem with some things is really herbals, not so much the synthetic vitamins. So the herbal stuff, I always advise people not to get the least expensive brands out there because I worry that they'd be contaminated with heavy metals and things like this. Even with spices, I don't know if you heard about that spices, like common spices, were contaminated with heavy metals. It's pretty
So,
outrageous.
yeah,
Yeah.
so it really, I think that is a problem with the non-regulated things. So nowadays we're seeing that even regulated things have a problem, but
Mhm.
non-regulated does have that. The purity, the quality may be varying, even within the same batches of from the same within the same company's batches, and then across companies as well.
Yeah.
So with this, once again, thank you very much for being with us. And Cool Beans, thank you very much for being here, for asking these questions. I would actually have a request to the Cool Beans. If this is a topic that interests you, what are your questions? Maybe we can come back and talk about those. Maybe I can do some of those topics as well. So I would love to hear what else would you like to talk about in terms of dementia. And Dr. Phillips, thank you very much for your presence. any message for the cool beans? So if you summarized the talk today,
If I
and let's say
summarize the
you're
talk,
talking with
yeah.
me and saying, here are the lifestyle and life, here are the
Yeah.
practices that should be done, what would you say?
Well, to my patients, I would, it's not about fat shaming or anything like this, but I encourage my patients, try to avoid being obese if possible by improving their nutrition and, you know, just when you're eating carbohydrates, to eat complex carbs with low glycemic indexes. I limit the animal intake that my patients, I try to, that my patients eat. A lot of my patients just are hardcore carnivores and they won't ever change. And some people are keto and eat a lot of meat. And there's definitely advantages, in many respects to that diet. But the diet that I usually recommend is kind of like a Mediterranean diet with complex carbs and lower animal products. And I always remind people about the low hanging fruit, the things like low dose, low doses of lithium and melatonin and NAD and theracumin, which is a bioavailable curcumin. It is one brand that we actually do recommend because it's the only one that I know that's been a randomized control trial to reverse early dementia and normal. What they said was normal cognitive decline of aging. Begs the question: is there such a thing as normal cognitive decline of aging when it's reversed by theracumin? But so these are
Coconut
take-home
oil,
messages. Yeah,
coconut oil, and if somebody has herpes simplex, then try as much as you can manage it. If you have early comorbidities, then try as much as to control them so that their pathology is reduced, which can lead to dementia as well. So reduction would help. And then I think generally relax as much as you can. Nowadays things are so crazy,
yeah.
but relax and be as happy as possibly you could be.
Always good advice. It's
Cool.
always good advice.
So
Because
thank you
happiness.
very much. Thank
Yeah.
you very much for being with us today. Once again, I'm just gonna, people are gonna criticize me for this, but I'm gonna close once again at your book's presence here. So there is a paperback as well. I have no commercial interest. I have no financial interest. This is not that Dr. Phillips asked me to do this, but I really believe it. This is a kind of book, eighth grade, ninth grade of a child, this should actually be taught in the school so child is aware if god forbid ever I encounter a chronic disease, instead of falling for it, instead of taking it as my fate now for the rest of my life, I have choices. I can seek help. So this is the book, uh, Kindle version, audio book, hardcover, paper book, audio CD. And so, Dr. Phillips and Dana Parrish, thank you very much for writing this book, for bringing it to us, and to be with us.
Thank you
Thank you.
so much for inviting me back.
Yes. Bye bye, guys.
Bye.